Hey everyone, this is Dr. Baten of Urogynecology Associates. So today I'd like to talk to you about overactive bladder, kind of go in depth a little bit about what is overactive bladder and what is the treatment options available for overactive bladder. And we're going to go a little bit into the causes, but not too deep. We're going to go more into the depth of the treatment. So what is overactive bladder? So there's two types of incontinence, two major types. There's multiple types, but there's two major types. There's stress incontinence, where you cough or sneeze and you lose urine. And that's a structural problem. That's the ones that a lot of people are more familiar with when they're treating with what they call a bladder tack or sling or something like that. Then you have overactive bladder, which the symptoms of that are urinary frequency, meaning you have to go to the bathroom more than you should. Also urgency. Now we're not talking about the urge to go to the bathroom. We're talking about when you feel the need to go, you have to go right then. You're knocking small children out of the way to get to the bathroom. That's called urgency. And there's also urge urinary incontinence, where when you feel that urge, it's difficult to control and it actually will come out. And then there's also waking up at night to get to the bathroom. Now, waking up at night to get to the bathroom can be part of overactive bladder, but it can also be a different disorder, kind of separate and by itself. We're actually going to do some videos on stress urinary incontinence and what's called nocturia, or waking up at night. So back to overactive bladder. Now, we talked about the symptoms of overactive bladder being frequency, urgency, urge urinary incontinence, waking up at night. That's the main symptom complex for overactive bladder. Now, versus stress urinary incontinence, which is a structural problem, overactive bladder is a functional problem. It is the function of the bladder, how the bladder functions. Now, when you look at the bladder, it's structurally fine. There's nothing wrong with the bladder. It's in the right place. Nothing's falling out. Everything's where it should be. It's just the way things are processed is not right in the bladder. Now, there's several causes of overactive bladder, and you can have one, or you can have a couple of different causes for it, or you can have one, you get that treated, and then it changes into a different cause of overactive bladder. We're not going to talk about the neurologic problems like neurogenic bladder, spinal cord injury, brain injuries, Parkinson's, things like that. That's a separate category. Similar symptoms, but a separate category. What we're going to talk about is like the main common things. If you're someone that this doesn't fit exactly and you don't fit into what we're talking about, don't worry. We're just doing this in generalized terms. Come see us and we can figure out what's best for you in your particular situation.